Public safety professionals from across Canada gathered in Regina this week to address the challenges faced by those on the front lines, with a primary focus on the rising number of psychological injuries affecting first responders. Sienko is the Chief Mental Health Officer and CEO of a diversified rehabilitation group specializing in treating first responders from across the country. Good morning, Derek. Thank you for being here.
Good morning. Thank you for having me.
So, to start us off here this morning, we're in the month, or in the midst rather, of this month-long campaign. Can you kind of tell me a little bit about how your campaign is sounding the alarm for these psychological issues?
Well, the main reason of our campaign is just raising awareness for us to do better for first responders. They are struggling when it comes to psychological injuries, and it is very important for us to be there for them. And it's not only from our perspective, but from every member who is involved in journey of first responders getting better, including community, government, local agencies, and first responders themselves.
Yes. And what kind of toll is this taking?
Well, it's taking a huge toll. Approximately 50% of first responders screen positive for psychological injuries, comparing to 10% of general population. Mm-hmm. And the other component is many of them are dying by suicide, and that's not right. All of that is preventable. Mm-hmm. And raising that awareness is the moving step forward to be there for those who are there to protect us.
Yes. And what kind of barriers are in place right now that make receiving these treatments really challenging?
So many barriers. One of them is organizational stigma related to not showing up that I'm weak, because if I show that I'm not doing well, then maybe impact my job, impact my performance. And there's also a self-stigma from the perspective that individuals who are first responders themselves don't want to come forward because they don't want to fail their peers. They want to be there for them, and also afraid if they show that they are weak, it means that they are not able to help themselves. Right.
And whose responsibility is it to ensure that these treatments are accessible for people?
Well, I think everybody's responsibility. We are here in it together, and we should act together to be there for them in every possible manner, from the government to an average citizen in the community.
Absolutely. And, what words would you give to a first responder who is struggling in this moment?
Just remember that you are not alone, and what happened to you, it's not your fault, and that you're not broken, that you are injured. And that help it's right there. We are here for you. Just reach out. I know this is a harder step forward, but you are not alone, and we are here for you as you are there for us.
Yes. And before we wrap things up, what was your biggest takeaway from this week and all of the learning that was had?
The learning is, first of all, that Regina is a beautiful place to have this, and especially this is where the research is being born and supported. So what I got from that conference and interacting with others, that it's very important for first responders leaders to be emotionally aware. Because when we are emotionally aware, then we can show our self-compassion, and then we can be compassionate to another human being, to another police officer, firefighters, correctional officers, and any other first responders.
Yes. Well, Derek, this is such an important conversation to have, and I really appreciate you taking the time this morning to come talk with me about it.
Thank you so much for having me.
Thank you.
Appreciate that. Thanks.